Global health officials are monitoring an outbreak of bacterial pneumonia in the U.S. that made its way from China and Europe.
CBS 8's Abby Black is here to explain if we should be worried about another pandemic on the horizon. Abby?
Marcella and Carlo, as the respiratory outbreak surges across the world, there's a global concern that there could be another pandemic. I spoke to an immunologist known for his work on the coronavirus. He gives us insight into what this outbreak means. An outbreak of a strain of bacterial pneumonia, now dubbed white lung syndrome, has infected children in China, Denmark, and the Netherlands, primarily between the ages of 3 and 8 years old. Ohio is now the first state to report the disease in the U.S. with 142 cases. Today, the CDC Director told a House committee these infections appear to be common bacteria and viruses that happen everywhere.
As of today, we do not believe this is a new or novel pathogen. We believe this is all existing, meaning COVID, flu, RSV, mycoplasma.
This time, China's handed over data that shows children have been sick with known pathogens, but the infections are still evolving.
Could this be a COVID type situation?
Of course, we're all concerned after the pandemic. We hear about an outbreak in China. We hear about outbreaks elsewhere. Right now, we don't think that's what this is. Of course, we're monitoring carefully.
Bioengineer, immunologist, and founder of San Francisco-based Sinovac, Dr. Jacob Glanville, was featured in the Netflix series Pandemic. He says while he continues to monitor the pneumonia outbreak, he believes due to COVID-19 and masking, children have not been as exposed to infections to help build up their immunity.
So if there's 3 years of no high alert, it's kind of like a lazy castle where the Huns haven't come by in a while, and so the guards aren't really, keeping their eye on the horizons.
Just this morning, the California Department of Health contacted Rady Children's Hospital to get a status on what viruses are showing up. Rady's medical director of infectious diseases, while there's a sharp increase in patient visits, they've not treated patients with white lung syndrome this year.
So far, what we're seeing is just a bad respiratory season. It's not overwhelming, and there's no mystery pathogen that's causing disease.
Like any illness, the best way to protect yourself and children is to wash your hands, keep vaccinations current, and seek medical attention if your child's breathing changes or if something just doesn't feel right.
I don't think we're seeing cases of enhanced death around these children. They're just getting really sick. And the best way to protect yourself is to bring them in early and get good medical attention if you reach that point.
I asked Dr. Glanville if traveling to states and countries dealing with this virus is safe. His advice, it's probably best to avoid them and do everything we can to limit the number of infections so we don't overwhelm the medical facilities here.
And so we know that local hospitals are seeing a high number of respiratory illnesses right now, different viruses, including whooping cough at Rady Children's Hospital. Is this going to be the new normal for us, seeing these high rates during the winter?
Hopefully not. And I asked Dr. Glanville that question. He addressed this and said, quote, to be blunt, this winter there will be a high number of infections, but he adds this is not the new normal and believes that this is just the hangover from the pandemic. Glanville says that once we get used to all of this traditional infections that we usually get this time of year, we hopefully will bounce back to normal.
All right, and a lot of people are going to be gathering together, family and friends over the holidays, so just good advice if you're not feeling well. Like they always say, just stay home.
Especially because it's like I have a 19-month-old and anytime she gets sick, I really worry. Is this COVID? Is it RSV? What could this be? Yeah. And so when I asked the doctors that, they said, you're the mom, you know what's best, but it's really when they get to a point, make sure that it's not too late. So they said the biggest sign is like if their breathing changes at all. And so that would be the best sign that they need to get urgent care.
Right away, get treated if, there's problem breathing. All right, thanks for bringing that to our attention.
Thanks, Abby.